All right. Well, our next oral abstract is from Iman from Cairo University. I was very happy to visit Cairo University a couple years ago and see all the exciting um, uh, um, research they're doing, all the very enthusiastic personnel, and just to see the clinic and where all the research is being done. And so it's just a great to know that we have colleagues in Cairo and actually all over Egypt who are doing wonderful research. And so now we're going to be hearing this oral abstract from Dr. Sany on T central memory cells in early versus late cases of localized and generalized non-segmental vitiligo. So Dr. Sany.
Good morning, I'm Iman Sany, lecturer of dermatology at Faculty of Medicine, Cairo University, and also proudly a member of the Egyptian Vitiligo group. I'm honored today to be part of the Global Vitiligo Foundation Symposium this year. The study I'll be presenting today is T central memory cells in early versus late cases of localized and generalized non-segmental vitiligo. I'm very glad I'm able to present this presentation today on behalf of my professors and colleagues. I would especially like to thank Dr. Samia Ismat. This whole study is her idea in the first place. So to start with, the idea of autoimmune memory has gained a lot of importance lately, especially after observing that disease relapses often recur at the same sites of previous lesions. A quick reminder on how the whole story starts. Usually it starts by inflammation in the predisposed skin, followed by antigen presentation by the antigen presenting cells in the draining lymph nodes. This leads to the formation of melanocyte-specific CD8 positive cytotoxic T cells and autoantibodies, which eventually lead to melanocyte damage. Different subsets of the CD8 positive cytotoxic T cells have been identified in the blood of vitiligo patients. This figure may help us also understand the picture more. Following microbial invasion, antigen-presenting cells lead to priming of the T cells in the lymph nodes. This leads to clonal expansion and proliferation of the activated CD8 positive T cells, thereby generating effector CD8 positive cells, which target the inflammation itself, and another group of T cells, which are the memory cells. They comprise mainly of the T-resident memory cells, which remain in the skin, in our case, and they have a very important role in maintaining the disease and in disease progression. They are the ones responsible for recruitment of T central memory cells circulating through the secondary lymphoid tissue and the T effector memory cells circulating through non-lymphoid tissue. By this recruitment, these cells help the T-resident memory cells in destroying the melanocytes that try to replenish or repigment the vitiliginous skin lesions. Back to the T central memory, they are circulating memory cells that are able to migrate back and forth through the blood and lymph back to the skin. Their antigen-specific T central memory cells have been identified in the blood of vitiligo patients in previous studies. How important are these T central memory cells? Actually, they are quite important. They are able to sense antigens. They are able to secrete cytokines and chemokines, and they are able to maintain the disease by cooperating with the T-resident memory cells, which by themselves are unable to destroy the melanocytes, but with the help of the T central memory, they are able to destroy any repopulating melanocytes. They are also very important in replenishing other T memory cell subsets like the T effector memory. Interestingly, it was found that inhibiting the T central memory cells or depleting them actually led to reversal of the disease in mice, which points out how important they are. All this led us to the aim of our study, which was to characterize the role of T central memory cells in the pathogenesis of vitiligo and evaluate the difference of T central memory cell percentage in the blood of early versus late cases of generalized and localized non-segmental vitiligo and compare them to controls. We recruited 61 non-segmental vitiligo cases, 30 generalized, 15 of them were early with the onset of 6 months or less, and 15 of them were late with the onset of more than 6 months duration. 31 localized non-segmental vitiligo patients were recruited, 16 of them were early and 15 of them were late, plus 30 healthy controls. In our inclusion criteria, generalized non-segmental vitiligo was characterized as vitiligo with lesions in more than one anatomical site, and localized vitiligo was that with more than one or more lesions in just one anatomical site. Both genders were included, and as we said, early cases were considered as those with the onset of 6 months or less, and late cases were more than 6 months duration. Segmental vitiligo was excluded, patients less than 14 years, pregnant ladies, and any patient with topical or systemic treatment of within the last 3 months was also excluded. Detailed history was taken from each patient. VASI, VES, and VIDA scores were assessed, and blood samples were taken and stained for CD8, CD3, CCR7, which is the lymph node homing receptor, and CD45 Rho, which is the marker of activated T central memory cells and T effector memory cells. Cells that stained positive for the 4 markers were measured using multiparametric flow cytometry. So the clinical data of our patients, we had 26 males and 35 females. Their ages ranged from 14 to 65 years with a mean of 30 years. The duration of the disease ranged from 1 month up to 38 years with a mean of 30 months duration. Coming to the results of the flow cytometry, we found that the percentage of T central memory cells was significantly lower in cases compared to healthy controls, as seen here in this figure. We also found that the percentage of T central memory cells in the late vitiligo patients was also significantly lower than early vitiligo patients. Here you can see that the late is significantly lower than the early. However, no significant difference was found between localized and generalized groups and different VIDA scores. Also, no correlation was found between the percentage of TCM cells and VASI scores, VES scores, or the number of lesions. So, to sum up the significant results, as we can see here, all the cases are significantly less than the controls. And late cases were also found to be significantly lower than early cases, as seen here. So what are the implications of those results? Lower TCM percentage in the blood of vitiligo cases compared to controls and lowest TCM percentage found in late cases compared to early cases and to controls indicate that the role of T central memory cells is quite important in the pathogenesis and maintenance of the disease. And it can be explained with their increasing recruitment to the skin over time. So with disease progression and relapses, more and more T central memory cells are recruited from the blood to the skin to maintain the disease. Therefore, early therapeutic control, even in mild cases, may actually help prevent progression and further recurrence of the disease. This is now a study that's ongoing on our department. And targeting T central memory cell production or survival or function may provide novel treatment options for patients. So to sum up, recruitment of T central memory cells in vitiligo appears to increase over time as evidenced by the lowest TCM percentage found in the blood of late vitiligo cases compared to early cases and compared to healthy controls. Therefore, early treatment targeting their recruitment may help prevent disease progression and recurrence of the disease. Thank you very much for your attention.
Thank you, Dr. Sany, for that interesting presentation. It looks like we have one question for you. Did you look at whether there was a variance in the number of melanocyte antigen-specific T central memory cells in different groups?
Did we look at the melanocyte antigen specific? Can you mention?
There are T central memory cells.
Yes.
That are actually have activity against melanocyte antigens that have been discovered. Did you look for those T cells that have activity against melanocyte antigens?
No, in this study we didn't do so. We just checked for the 4 markers, the CD8 and the ones we used in the study, but we didn't check for antigen-specific melanocytes.
Okay. And then another question: do you have any information on the T central, the resident memory T cells found in the skin and their early and late disease? You did not look at skin. You only looked at the central memory.
No, we did look at skin, but this is like the second part of the study that's still ongoing.
Ongoing, okay.
Look at the same group of patients, and we did the same exact groups, and we measured in the skin the T resident memory cells, but the results didn't come out yet.
Thank you. Well, it's very interesting to see that in your study, you saw that the number of cells was lower in patients with vitiligo, and your assumption is that these central cells are migrating to the skin, which is the reason that their numbers are lower in the blood compared to controls. But again, this is a theory that this migration is taking place. It's very hard to evaluate total numbers. There could be marginalization of the T cells at the margins of the blood, in the blood vessels that don't go into the actual blood circulation, but stay in the margins of the blood vessels. Some of them may be recruited to the skin, some of them may not. And this has been one of the difficulties in looking at blood in vitiligo patients as opposed to looking at skin. But this is helpful to do this additional study. So thank you very much.
Thank you too. Thank you very much.